Hi, I'm Dr. Tener. We're here at the Goldberg Tener Clinic, joined by Erica Adams. Erica is from New York.
Upstate New York.
That's right. And she's here 10 months after her initial visit. And we've got a remarkable story to share with you. She has done wonderfully. And so, Erica, what were you originally diagnosed with, and what did you come in for help for?
I was diagnosed with rheumatoid arthritis a few years ago, about 3 years ago. And I went up and down with some symptoms. I got a little bit better with some medicines. And then after about 2 years of the medicines, they really, I think, started to not work. And then I was having the side effects from the medicines, I think, with hair loss and that type of thing. And then all of the symptoms seemed exacerbated. And I was having a lot of joint pain, swelling.
You went to see a rheumatologist.
I had been seeing a rheumatologist, and I think she just kind of switched me from med to med, added things, but that was about it. And then, like I said, hair was really falling out, and I seemed to be like at the end of my rope. So,
what was your quality of life like at that time? I know you like to be active.
Right.
What kind of things were you unable to do as a result of your condition?
I was having a really hard time just getting through the day. I'm pretty stubborn about going to work, so I was still going to work, but coming home and taking a nap, which is very, very uncharacteristic. I have 3 kids, so I was trying to still keep up with all of that and, work and all of that, but it was difficult. I was having a hard time in the morning, getting out of bed. I would say my quality of life was the worst it had been, in my life, for sure.
Yeah, this is typical for patients with rheumatoid disorders, and the course medically is fairly predictable. Patients go in with symptoms, testing gets done, they get labeled with one of a number of different rheumatoid disorders, in your case, rheumatoid arthritis, and then out come the immunosuppressant drugs. The drugs don't really address the cause of the problem, they just basically cover up the symptoms by suppressing your immune system. And in most cases, patients get rotated from one drug to the next, to the next, to the next. You were on Humira. She had also taken Prednisone at times, and also had been on Methotrexate, pretty typical drugs. They have lots of side effects. As we were discussing before, the Humira can give a patient cancer. That's one of the potential side effects, tuberculosis, infections, all kinds of things. And so Erica was very interested in getting well and getting off the medical train.
Yes.
Yeah. So we didn't treat Erica's rheumatoid arthritis. We don't treat any disease, even though we work with people that have just about any type of chronic health issue. Our focus was to identify why you ended up there in the first place.
Right.
Yes, these things don't happen in a vacuum. There are factors that lead to these things, and they can be different in different cases. We work to identify what those factors are and then address them directly, and then get Erica doing the right things to build health. Now, some of the things we found in her evaluation was that she had digestive issues, which is oftentimes found with patients with rheumatoid disorders. Most of the immune system's in the gut, so we look very closely there. There are also dietary factors, issues with drug side effects, lifestyle factors, toxicities from toxicology testing that we had performed. So we had a number of different factors that we were contributing, playing a role in this problem. And then we developed an action plan for you to implement. We worked from a distance, over email and phone for a while. And it's been 10 months now.
I'm like
a dramatic shift.
Yeah.
So tell us about what's changed.
So I feel like a completely different person, better than I have in, I don't know how many years, but a long time. My stomach has never felt better, so that's huge for me. I can just get out of bed in the morning and not be like creaking, for the first few steps, which is sometimes I even forget where I was at, even though it's only been 10 months.
The joint pain and swelling you were having?
The joint pain and swelling, I'm completely gone, basically. My hands were the first to bother me and also the last to get better, but now they're better, which is remarkable to me. The whole thing is remarkable, but really.
Well, it's the power of the human body coupled with the right steps to facilitate the body's own healing capabilities. Now, last time you were here, actually I spoke with you back in August, you had mentioned being able to do some things you hadn't done in years, particularly with regards to being active. So tell us a little bit about that.
So I went hiking this summer for a couple different peaks in the Adirondacks in New York, and which felt like fantastic. I paddled 25 miles on a canoe trip. I've been jogging recently, which I haven't done in probably 10 years.
And this is all, you're off drugs entirely.
Off drugs.
No drugs, no Humira, no methotrexate, no Tylenol, no diclofenac. You know, all the drugs she was taking before, she's entirely off of. And we have had new blood work several times on her. All of her inflammatory markers, the CRP and the SED rate, which are two excellent measures of systemic inflammation, are entirely normal, not just normal, but healthy, excellent. And that's consistent with the substantial improvement she's had, because these markers were elevated before. So we have some objective data along with the subjective improvements that she's had. Yeah, so wonderful progress. She looks great. She feels great. We did a
hair is growing back.
Hair's growing back. Yep. Always a good thing.
Always a good thing.
Yeah, I have a problem with that. I can't fix that. But for you, definitely a thing we wanted to accomplish. Digestion smooth. Everything's working well. Did a physical exam. Her physical exam is excellent. Her grip strength is strong. It's about twice what it was the last time I saw her. So absolutely thrilled with the improvements. Her case is just a great example of what's possible. When we do a good evaluation, we identify the causal factors, we take the right steps to address them, and the patient works hard with us. One of the things that's worth mentioning with you, Erica, is that it wasn't just a straight shoot from point A to point B.
Right.
Like most of our patients, she had ups and downs in the process. We call them bumps on the journey, but she persevered through
It was
them.
a pretty bad bump for about a month.
You went through a flare-up in the process,
But I did, and with your encouragement, I have to say, I persevered. I got through it, and really after that has been nothing but progress. So, completely worth it. I mean, I tell people all the time, I could be like a poster child for your business, but I tell people all the time I wouldn't have believed it, I don't think, except that I did it and I lived it, and now here I am. But it was hard for me to see the end when I was feeling so sick. Hard to see beyond it.
It's hard to persevere through those bumps, but the body oftentimes in the process of getting well is going to have to go through kind of a righting of the ship, which oftentimes involves temporary discomfort. Part of the value that we have when we work with people is that we've worked with a lot of people. I've been here for 16 years. Dr. Goldberg's been doing it for 50 years. Worked with a lot of people in this situation. We know what to expect, and we educate the patient on what to expect too, so that if symptoms do arise, which they commonly do in the process, the patient knows what to do and why it's happening, and knows to persevere and work through it so that they can come through on the other side, the light at the end of the tunnel where you have achieved. So that was a big, I think, part of the process of her getting from point A to point B and all the success that she's had. We've made a great team. We're doing great.
Fantastic.
We continue to work to maintain all this good progress. And your story is really going to serve as an inspiration to other people. So,
well, I hope so.
Yeah, thank you for sharing. Any last words?
I think I just would encourage you to really follow your heart if you're feeling, the calling to go on this journey, because it's going to be worth it in the end.
Thank you for sharing, and I look forward to your continued success.
Thank you very much.